Hey, everybody. Welcome back to another edition of DPH Clinical. I got the guys from Colorado Surgical Institute, Dr. Dan Briskie, Dr. Taher Dhoon. Thanks for joining me again, guys. How are you doing today? I know Taher's got a good story. I don't even know what we're going to title this episode. We'll see where it goes. But Taher has a good how-to life hack that is going to be very applicable to all of us in the dental industry. And hopefully it works for our hygienists and everybody else on our team, too. But I don't know. I want to hear this. Taher just got out of jury duty. Talk to me about that.
It's definitely an interesting experience because they waste so much of your time. So number one, as soon as you get the summons, you can actually request for it to be at a different date, and you can push it out depending on the state. I think it's 6 months to a year. However, the time will come where you have to actually show up and do your due diligence as a law-abiding citizen giving back to society. But it's super expensive. And what I found is there's a lot of people who are in that room who want to be there because they'd rather be there jury duty versus at their own jobs. Whereas for us, it's thousands and thousands of dollars depending on how big of a case you get selected for. So what I did is I made sure I had a hotspot on my phone. I took my laptop in and I'm getting work done while I'm there. So get caught up, make sure you have stuff to do, make sure you got a project to work on. Just don't waste time kind of reading a book or just sitting there. Or if you want to catch up on the show, headphones and watch your show. 2, make sure you object to everything. Okay. In the beginning, they'll say, hey, does anyone have any hardship? And technically speaking, we don't have hardship. But what you can say is, I have hardship because my employees depend on me. My patients have surgery scheduled. They've already made changes in their lives, maybe on their medications and their work lives and for their sedations. So the ramifications of me being here for a 5-day or 2-week trial has significant impacts into a lot of people's lives. And then they're going to ask who feels, and they ask a bunch of questions, but the other one that's low hanging fruit for us to knock out of the park is who here thinks that they cannot be unbiased when it comes to this case? Dude, that's a softball question. Okay. Raise your hand. And they give you a microphone, at least in Colorado. They give you the mic and you actually have to speak in front of the entire courtroom. So it's a little nerve wracking because the judge is looking at you like, all right, this jackass is talking again. Like, what's going on? One of the cases was armed robbery and, he had shotguns, ARs, and was robbing a bank. It was his second time being convicted, or allegedly whatever, of having a firearm illegally. So I just told the judge, I was like, Your Honor, this guy is here a second time, and it's weird because the guy's staring right at you, sitting literally 10 feet away. Your Honor, this guy's here his second time with a firearm charge. In my head, there's no way that he's not guilty. How in the world could he be here for the same thing 2 times in a row? I'm going to vote guilty. He's guilty in my mind.
Death penalty. And
nothing's going to change my mind. So immediately they're like, all right, get out of here. You're good. And then you have to go back to this waiting room, and they might call you for another courtroom because they have multiple judges who are all running their individual trials. They get called into another one where it's a teacher who was terminated suing the school district and the principal or the super.
Oh my God, dude, my wife used to work for that school. It's funny that
the Pueblo one?
No, it's a different school then. Because there's one that's going on right now for a Denver school for suing one. I was like, oh my God.
Briskie, do you want to share the name of that school and the name of the superintendent?
Oh, no. Lord, have mercy. It's a trap. It's a trap.
Yeah.
So I did the whole hardship question, answered the same shit. And then when it gets to who's biased, I was like, I raised my hand. I'm like, I'm biased. I'm like, hey, as someone who employs a lot of people, I can't be unbiased here because I've had a lot of frivolous allegations against me in terms of I've wrongfully terminated people who have been under my employment. And quite frankly, from an employer's perspective, I think that it's unfair that all the laws are written to protect employees and employers are not protected by the judicial system. So for that reason, I don't think I could be unbiased when it comes to it. So you have to kind of think on your toes, have a notebook, write down ideas and then circle the one that's best and then raise your hand and talk to the judge. But they were pretty easy to say, hey, all right, we don't need you anymore. And then I've done my jury service. I think it's for 4 years or whatever the time is on it. One trial was going to be 5 days. Right. What's my production for 5 days? And the other one with the armed robbery was like, they say, hey, we have it estimated at 2 weeks. Like, dude, if I'm out 2 weeks, that's a really bad month for us.
One of my wife's coworkers, my wife's a hygienist, and she used to work at a pediatric office, and one of their hygienists got selected for like a murder trial that I want to say it went like 4+ months. It was like super long. So you had to still show up and go to the little room. You didn't get out of that part.
Correct. You still show up. You still go into the courthouse. Then they dismiss you and you go back to the room. And then once every judge for that day fills their jury for that the trials that they have scheduled, then they release you. So there was 3 judges asking for jury members that day. I only had to go into 2 courtrooms. And by the time I got to the 3rd, they had already filled that jury. So they let me go.
Mm-hmm.
I was there till 3 p.m.
Yeah, I don't know how to get out of like going at all. I haven't been asked for a really long time. I can't even remember the last time I did it.
Yeah. And here's the thing. Like, you can maybe get out of it. You can say, hey, I mean, I got a trip scheduled and I can't make it. And then they put you on a list to re-contact you in the future. But sometimes they don't re-contact you for a very long time, depending on the population of who they're selecting from. You can just dodge it just from strictly saying, I got a vacation, I can't make it.
Wow.
Yeah.
Right.
I'll add one thing to it where I advise Dr. Dhoon to do, because this is what I did. I made it to the same stage as he did. But what they didn't know was underneath my jacket, I had a Donald Trump t-shirt.
You got to wear a MAGA hat to your jury duty.
Yeah, you do. So what I did was made to the same stage as him. I was sitting in front of the guy, and he asked the bias question. And I stand up with my Trump t-shirt on, and I say, sir, I'm a doctor, and you're not going to change my mind.
That's good. You ever see the Curb Your Enthusiasm where Larry David gets the Make America Great hat again? He just puts it on in like random situations. He's like, people just don't mess with me if I have this hat on. I think the reason why he did it so no one would sit next to him somewhere or something like that. I can't remember what it was. It was funny.
But I just went for the appalling portion. So I tried to think of what would be the most appalling thing for that specific crowd. And then for the courtroom, and then I went with that.
Yeah, all great tips.
Yeah, and here's the thing. If you're in a red state, go the exact opposite, right? Pick the most liberal person, wear blue, do whatever you got to do. Yeah. It's a little bit of drama. It's a little bit of theater. You have to be okay with people looking at you like, okay, this jerk here, but you're saving yourself thousands of dollars by just playing the role.
Mm-hmm. Yeah, no kidding. I don't know if I've never had to do this yet. I think I could pull off the gig now. I could do it.
Oh, dude, I have no doubt. They'll throw you out of there so fast.
I'll be like one of those guys like from like the colonial period with the hats like, lend me yours, gentlemen. I have the floor. Are we going to talk about teeth?
Yeah, I mean, we could talk about implants a little bit if we want to. That's an interesting segue.
Well, this is the random episode. It's the randomness.
Okay. Random fact. Don't reuse healing abutments. No, I've done it for years. There's new literature out. Dr. Briskie knows the lit better than I do, but we're hearing through the pipeline, and it's been out there for a while now. But anyone who's reusing healing abutments, don't feel bad about it. Just stop doing it. And Dr. Briskie will provide the reasoning behind that.
Yeah. So there was a study, I think it was 2021, and they sterilized, I don't know how many different types of implants. They studied the bacterial culture based on how it was sterilized. And the bacterial load was reduced, but the bacterial burden was never gone. So what they're saying is that no matter how many times you sterilize something, whether it's sterilized or bleach or whatever, there's still bacteria attached to the surface. And it just gets worse the more and more and more that you use it. And there was something even recently, I remember seeing, I think it was less than 2 years ago, that a dental school, I think it was UNLV, the faculty practice, this dentist wasn't really doing anything wrong because this type of research wasn't out yet, but they reused healing abutments, and the news basically said, oh, local dentist has reused healing abutments and parts on maybe up to 200 people. So I definitely don't want to be subject to the news in terms of their interpretation of how my profession is going to be working, because you say something like that, there's going to be a whole line of lawyers and news journalists outside your door waiting to bite on that one. Right?
Well, just think of how horrible that sounds. I mean, it's like that oral surgeon that was reusing syringes. Like, wait, you're sticking that in somebody else's body and you're putting it in someone else's? Like, what the hell's wrong with you? People are going to get AIDS. It sounds just like that. to someone who really doesn't know, well, it's just kind of going into the implant, which is in your body. It's not really in your body, I guess. It's not going to look good in headline.
Healing abutments are single use. They say it on the box. It doesn't cost really that much more money to use it and stay legal. So nowadays, Dr. Dhoon and myself do not reuse healing abutments. We just don't.
What do you do with your failed implants?
I return to Neodent because I get my money back.
You could do that?
Yeah. All Neodent implants, you can actually return them, which is awesome. So if it's a spinner or if there's a broken prosthetic part or just a failed implant, they guarantee a lifelong implant. So you can actually just return it and you'll get a new implant that comes mailed to you, which is really cool.
Oh, I use them as analogs.
Yeah, or if you just wanted to drop it by accident. No, I'm just joking. Don't do that. But try the return.
It'd probably stay.
Yeah.
Right? I mean, if you're putting an implant in, like, is it okay if you're using it on like a dog or something? I don't know. Like, what's the line here? What is the ethical line, people? I don't know.
Yeah, right.
I use it as analog because it makes me feel good. Like, what's an analog? Like fucking $8 or something like that?
Yeah. Cheap, right?
Yeah.
But those are lab parts. So those can be reused. But to stay in the mouth for an extended period of time for a few months or a few weeks, it's not rated for that. As opposed to endophiles. Endophiles are multi-use technically. A lot of them are. They're rated for that, depending upon what you use again, right? But you just have to check for if it is single or multi-use.
Yeah. Good point.
A quick clarifying thing is if you're seeing the patient and you try in a healing abutment and it doesn't fit, and then you go get another healing abutment, that one you tried in for 0.1 seconds, you can clean that one and you reuse that one. Or like same thing with a multi-unit, right? Just for clarity, if it's been in the patient's mouth for 3 months, that's when all this biofilm and all this crap accumulates on it. That's when you're going to get into a little bit of trouble. And that's when you want to just reuse it. You can lean on a lot of your implant reps for free cover screws and healing abutments. You're not going to get multi-units for free, but healing abutments and cover screws, you can really lean on them and try to get these for free. And you'd be surprised at how they'll kind of come around if they can get your business and give you some free stuff. And then you don't have to worry about the additional cost. And so that's what we've done in our practice.
Well, you guys are dropping screws like crazy.
No, but even when I switched over, right in the beginning, I was like, hey, I'm switching from Blue Sky Bio over. What can you do to sweeten the pot? Because Blue Sky is way cheaper than you guys. And he said, okay, well, we'll factor this in. So now it's getting our delta a little bit closer. The rep was still making money. And then he got my business. And then, of course, we started dropping a lot of screws with them.
Yeah. Okay. All right. So don't use healing abutments. How to get our jury duty. Don't use healing abutments. Don't reuse healing abutments. We should use them.
Don't reuse. Yep.
What other random stuff we got to hear?
When it comes to drills, if you want to try, like, let's say you're in startup mode, you're watching all the costs, or even just like you're being economic with it, think about the drills you're going to use the most. You're going to use your land spur, you're going to use your 2.0 and your 3.5 drill the vast majority of the times for like 95% of your cases. So what you can do is you can open up your kit. You can just take those 3 burrs out, individually package them, bring them into your op, and then just use those 3 and your implant driver, and then place your implant. And let's say you need to get a 4.0 or a 5.0 or whatever the case may be, then just pull that one specific burr out. So when you run everything through sterile, you're just sterilizing 3. Because every time you autoclave your entire kit, it's subtly dulling the burrs ever so slightly, where they cut less. And if you look at the burrs you're going to replace the most, you're going to replace your Lance, your 2.0, your 3.5. So then all you order is those burrs. You keep a full stock kit, but you're barely ever going through these things because you're just ordering a few things and being very economic with it. And you keep one set of Lance burrs, 2.0s, and 3.5s that are brand new on the side. So in the event you run into that D1 case where it looks like someone poured concrete in their jaw, you got a brand new set of burrs to kind of go through it and cut it as cleanly as possible. That worked out really well when I was in scrappy mode because it saved a lot of costs on instrumentation and all that stuff for me.
Ever since we started using Relevance Online Marketing, I could see a drastic improvement in our SEO. I mean, we are ranking so much higher when searching for dentists in our hometown. We are seeing more new patients, and certainly someone you should give a look at if you're considering new marketing companies.
Just absolutely awesome. I would recommend Relevance to any practice owner who wants to see what proper marketing can do for their office.
I want to thank Dr. Paul Etchinson for introducing me to Relevance Marketing. They've done a great job, very thorough. I'm happy with the results. Thank you guys for all of your help.
We never truly realized how powerful this could be. It's really changed our business for the best.
I think they're definitely worth every penny. Easy to communicate with, easily accessible, does what I ask, and even shows me some reports when things are going a little bit off track and what they're doing about it. It's just a level of service I just haven't really received from other marketing agencies.
Since we've been using Relevance, we've seen a tremendous growth in our business. I would recommend their services to just about anybody. Search engine optimization and getting your ranking on Google to be the highest it can possibly be. The efforts by Relevance and their team, and the efforts and the things that they've done with the SEO as well as the social media. Highly recommend it.
So what are you waiting for? This is Dr. Paul Etchison telling you to get a free consultation with Relevance. As a listener of the podcast, you get the first month free, and there is zero obligation to continue if you aren't blown away. Make this the year you grow your practice to the next level. Go to relevanceonlinemarketing.com to set up a free consultation. That's relevanceonlinemarketing.com. Do you keep track of how many times you've sterilized a burr, a 2-hour? I'm just curious what you do.
I don't do it anymore. I used to have a mark it with a Sharpie every time they went through the CSR wrap and mark it all. You can be very intentional about it, more so than not. I'm at the stage where if I feel I can feel it tactily, where I have resistance in the burr, I just don't feel like it's cutting, I'll take it and toss it and replace it. Sometimes your reps also will be very kind with replacing instrumentation. And if you're only asking for a few select things, they'll be nice enough to maybe replace a Lancer or 2.0 burr. And you can cut down on your expense from an instrumentation perspective there too.
Yeah, I got a nice little tip. If you think your 2.0, your pilot drill is dull, make sure you're spinning it in the right direction before you throw that thing out. Sometimes it may be going in reverse.
It could be. And you got to check those things.
Yeah. No, not me.
The correct answer, I don't know. Just pick an arbitrary number, right? Say like 15 or 20 if you really want to get down to it, and in terms of you using burrs. But for most systems, especially for like Neodent and others, you just replace them as they go dull. But you obviously don't want to do that if you're using a Versa burr, right? That's going to go dull and you're going to burn the bone and you're going to end up with a lot of failed implants. So it depends what you're using, right? And if you're going to use Versa, then you should probably replace that thing every 15 uses as well. And those are some expensive burrs.
Do you guys ever skip a burr in a sequence or skip an osteotomy drill?
Oh, all the time. All the time. I'll jump from a 3.5 to a 4.0. Sometimes I'll just take my 4.0 in like an eighth or maybe like a third of the way in just to open up the coronal portion. I'm not doing things based on the recipe that the implant company gives. I kind of go off of tactile sensation. I like the improvisation of how you can approach surgery, and I'm hopping around and skipping stuff all the time.
Question. It's something since we're just doing random. You go to torque in your implant, it's torquing way too hard. You don't like it, you're going to back it out and open up a little bit more. What do you do with the implant?
I've seen oral surgeons just grab the implant and throw it on a piece of gauze and grab it with their gloves and whatever, right? As long as it didn't hit the floor, I've seen them just like reuse it and just drop that sucker back in. I've seen them do that with zygomas. First time I saw that, I was like, are you guys sure you want to use this? Like, isn't that dirty? Isn't this thing like nasty? What I do personally is Neodent comes with their little like clear tube. And so I have saline on the side. I'll just pour some saline in it. I'll take it and I'll drop it into some, it's not bacteriostatic saline, but it's basically from a bag that's clean and sterile. I'll drop the implant in there. So when I come around to using it, I'll put it in and I'm not leaving the implant sitting around. Other times, if I know I'm going to use it super fast and the blood's not going to like clot and dry on the implant, I'll just leave it on the driver and I'll stick it inside my surgical kit upside down so nothing's touching it. And then I'll grab my extra burr. I'll drill my osteotomy to where I need it. And then I'll take it and put it on my drill and then just drive it back in. So that way nothing ever touch. I try to have nothing ever touch it. I try to have my gloves never touch it. God forbid my glove slips and it touches it like, half a millimeter. I'm still using the implant. Your Honor, I didn't say that. It was a podcast. I'm acting. I've never done that.
You're biased. You got all this bias.
Yeah.
He's got all this bias against implants and stuff. Why is that? What is with the latex and the glove and touching the implant thing?
I think at the end of the day, it's just that titanium to bone interface. Like you don't want like tissue wrapping around the threads as it enters in. You don't want the palatal tissue leaning on your implant and having epithelial cells get inside in between the titanium and bone interface. You want to be very careful. I think a tip to do is before you place your implant in the osteotomy is to get a curette and really curette any soft tissue tags away directly from the osteotomy, because you'll be surprised. There's like little tissue fibers around there sometimes. I think that's a huge thing to do. But if your glove accidentally touches it, I mean, I don't think you're going to get like latex inhibiting the interface in that one scenario. So that's kind of like my rule of thumb, but I do everything I can to not have anything touch that implant if I can help it.
Makes sense. Briskie, anything you want to add to that?
No, same thing, because I'll bring a suction tip. I'll bring the surgical suction tip to the osteotomy site and just run suction right over the top of it and see if any periosteum or tissue is still left there. And if it is, that's when you scrape it off or grab a tissue forceps and pull it off. Because what you don't want to have happen is, just like Dr. Dhoon said, is you get tissue inside the osteotomy could actually cause a fibrous integration of the implant, and the implant will just not become integrated at that point because there's soft tissue that's wrapping around it. Common mistake people see all the time. We see that quite often in our courses. And to kind of touch on when you remove the implant, right? And you were saying you unscrew it and you drop it. Most of the time, you don't need to unscrew it all the way. I mean, what I aim for is when I'm placing an implant, I try to put my settings at 30 Newton centimeters for it to stop. So that way, when it's actually driving in with my implant handpiece, my goal is to have the implant stick outside the bone by about 2 to 3 millimeters. And if it sits out the bone, like maybe like 5 or 6, then yes, I'll do what you said and I'll back it out. But for the most part, we don't need to remove the implant in and out a bunch of times. The implants are self-winding. They'll just screw right down, which is awesome. And if you're ever worried about that infamous term of pressure necrosis, like people talk about all the time, for the most part, it's not even true. What happens when people they will place an implant, they'll be so happy that they've got the implant in that they'll leave it even with the crest of the bone. But leaving an implant even with the crest of the bone is just cortical bone. So you don't have blood supply, which means you get bone loss because there's no blood supply. That's not really osteonecrosis. That's just the fact that, well, that's not pressure necrosis. That's just because there's no blood and the bone has to remodel down to a part where it has biological width. A biological width of 3 is what all the papers say. So if you ever get to the point where you just can't bring it down and you're worried about it, I'll take a ratchet to it and I'll go reverse by 2 clicks out. I'll take my ratchet and go 2 pumps out, and then I'll switch it to back in and I'll go 3 in. So you're self-threading the screw in as you're doing it. So I go 2 out, 3 in, 2 out, 3 in, and you're just creating a path for the implant to go in.
All right. Very cool. Well, thanks so much, guys. Go check out ColoradoSurgicalInstitute.com to check out these guys' courses. They are fantastic. If you want to learn more about surgical stuff, go there or just shoot them an email and reach out about what procedures you want to learn how to do. All right. Thanks so much, guys. We'll talk to you next time.
Have a good one.
Thanks, man.
Hey, everybody. This is Dr. Dhoon from Colorado Surgical Institute. Just wanted to give you guys a shout out and let you know about the program. We have full arch surgeries. We have lateral sinus lifts. We have block grafting courses, all done in one weekend with the whole digital workflow with photogrammetry units, scanners, 3D printers, milling, you name it, anything regarded to full arch, we cover in depth. We also have a PGCA course. What that is, it's the Postgraduate Clinical Accelerator course, where we are going to be covering wisdom teeth, single implants, and it can be complex single implants with vertical sinus lifts. We'll also be covering full arch extractions with ridge reduction, bone grafting, PRP, suturing, and we also will have a course on socket preservation. So if you guys are interested in any of those courses, please reach out to us at Colorado Surgical Institute. The code is HERO10 for 10% off our courses because we love Paul Etchison and his podcast, and we're here to help. And we're here to help. And we're here to help.